Hello friends and my dear viewers, I am Dr. Kiran Shekhar. I am the Chief Infertility Specialist at the Kiran Hospital and Kiran Infertility Center, which is situated at Hyderabad. That is our main branch here in the country. We have other branches also in Madras, Chennai and Bangalore. One of the latest trends I would like to talk to you about, that is stem cell therapy for ovarian rejuvenation, and again making the ovary a bit younger to give us more oocytes. Now for a long time we have been forced into taking ovum donations etc. for patients who are having a very low anti-Mullerian hormone level, that is below 0.5 level in AMH, and those who have a low ovarian volume and their antral count of the follicles, that is the egg numbers, are reduced in the ovary. Now in such situations we used to get very low egg yield, and then we could not make many embryos to get a good result. But now one of the main breakthroughs and the new technology which has come to help us is called as a stem cell therapy. I think all of you must have heard about stem cells, which are being used in various branches, all the branches of medicine almost now, because to regenerate the tissues, that is to make the tissues new. And this is very applicable to the ovary and the uterine lining also, in which we are concerned in infertility patients. So now what we do is actually in this procedure give the patient a local anesthetic or a general anesthesia or a spinal anesthesia, and then take out the bone marrow cells. Bone marrow cells are the ones which have very rich in stem cells. We cannot get it from the peripheral blood of the patient. So there is a special technique we can call the hematologist or a person who is expert in this, call them and then ask them to aspirate bone marrow about 60 to 100 ml. Once we extract the bone marrow like that, we process the bone marrow to get the stem cells. The yield of the stem cells will not be very high because lot of tissue, a lot of this thing is blood is needed to actually get stem cells which are 2 to 3 ml. But this 2 to 3 ml actually play the magic. We take this into a syringe, process it, isolate it, take it into a syringe and then inject it into the ovary. This injecting into the ovary also is a very simple procedure, because we will take the stem cell into the syringe and inject it into the ovary with the help of an ovum pickup needle, which we use actually to pick up the eggs. So the same needle will go vaginally through the natural passage, and then it will go and approach the ovary. We can see the ovary on the ultrasound, go there and inject this into both the ovaries at different places. This will actually increase the egg yield in the next or 1 or 2 cycles, and we get more eggs and the patient can conceive with their own eggs. So this is a very simple and very optimizing result for the IVF patients. It's a simple process, not very problematic for the patient at all, and then we can actually get lot of ovarian rejuvenation, which will help the patient to conceive, and her hormone levels would go up. And if we are finding some difficult process in the implantation of the egg, of the embryo in the uterus, then this will also be helpful. If you inject these stem cells, they will create new endometrial cells, and then the uterine implantation will be good. That is the stem cell therapy now, which is recently come for ovarian rejuvenation and to improve the endometrial thickness.